submarine is the most powerful vessel in the U.S. Navy's arsenal. Living aboard a submarine presents some unique challenges: smaller crew size, confined spaces, and because of these challenges, submarine crews develop a special kind of camaraderie. One of the most important submarine crew members is the Independent Duty Corpsman, or IDC. The Submarine IDC is the only trained medical crew member on the boat. There are no medical officers on board and no other corpsmen. The Sub IDC is part healthcare provider, part counselor, clerk, lab technician, hygiene expert, mentor, and confidant to the rest of the crew. If you're a Navy corpsman, being a Sub IDC presents perhaps the toughest challenge available to you, but also the most rewarding duty. As a Submarine IDC, you are truly independent. You alone are responsible for the health and welfare of up to 150 crew members. You must have the knowledge and skills to treat a variety of illnesses and injuries, because you must take care of them all, regardless of the severity. You must also manage the administration of the medical department and manage the radiation health program, monitoring the crew for radiation exposure. You provide dental care, manage the preventative and occupational medical program, perform medical laboratory analysis, manage the atmosphere control program, ensuring that the air aboard the submarine is safe to breathe. Make sure the drinking water is safe for the crew. Perform gas-free engineering, certifying that confined spaces are safe to enter. And you are often called upon to act as a confidant or mentor to crew members. You are the medical department representative, the only enlisted department head on the submarine, acting as an advocate for the crew's health and wellness, and as a barometer of the crew for the commanding officer. You are the doc. It's a challenging, formidable task, made even more so because you accomplish it aboard a submarine. You have to be able to adapt and use whatever space is available for any necessary treatment. The conditions are daunting, but as one of the most versatile and highly trained medical professionals in the world, you can meet the challenge. The job requires intelligence, initiative, ingenuity, organization, perseverance, and stamina. It requires the ability to do more with less. Many people believe it's the most difficult and demanding assignment in the Navy, but if you're up to the challenge, the rewards are plentiful. As a Submarine IDC, you are guaranteed an operational billet directly upon graduation from Submarine IDC Training School. You'll receive submarine duty pay that continues when you return to shore duty, proficiency pay, and sea duty pay, and the promotion rate is often higher than normal. But beyond these initiatives, being a Sub IDC offers many other rewards: true independence, great responsibility, and the camaraderie that life on a submarine offers, unlike that of any other Navy assignment. As a submariner, you'll travel the globe with an elite crew, and you'll visit many ports in many countries throughout the world. Once you finish your first submarine rotation, your skills can be applied to a large number of other assignments in major treatment facilities, clinics, overseas billets, research units, dive units, deep submergence units, submarine tenders, and you are also qualified for any surface IDC assignment. You might also become an instructor in the Submarine Independent Duty course. All submarine IDCs receive their training at the Naval Undersea Medical Institute, or NUMMI, in Groton, Connecticut. As a Sub IDC student, your training will consist of a 58-week course that begins with 6 weeks at the Basic Enlisted Submarine School, or BESS, in Groton. At BESS, you'll learn all about the basic theory, construction, and operation of nuclear-powered submarines. The course also includes instruction on submarine safety and escape procedures. The next phase of your training consists of radiation health training at NUMMI. Radiation health is a large component of the Submarine IDC's job, and this phase can be strenuous, but the NUMMI instructors are there to help you every step of the way. The radiation health phase is followed by clinical and operational medicine instruction. The curriculum is challenging and intense. You'll study every system in the body and the diagnosis of a wide variety of illnesses and diseases. You'll also study atmosphere control and sampling, and you'll learn how to perform numerous laboratory procedures. Soon after the medicine phase begins, each student is given a simulated submarine crew of 15 fictitious names. You'll be required to create and maintain complete medical records for each member of your own simulated crew. Throughout the course of study, each student is assigned a faculty mentor who is readily available for one-on-one instruction, academic advising, or career counseling. Near the end of the medicine phase, you'll participate in a week of intensive scenario-based tests that will test your knowledge of everything you've learned in school. You'll also participate in clinical rotations at nearby partnering medical health facilities. These rotations will give you valuable training in anesthesia, trauma and critical care medicine, and emergency medicine. After clinical training, you must pass a final oral board, and your simulated crew program must also pass inspection. To enroll in the Submarine IDC program, you must be a citizen of the U.S., an E5 to E7 hospital corpsman with at least 6 years' time in service and at least 4 years' time in rate as a corpsman, not more than 30 years old, physically qualified for submarine duty, and with secret clearance. Upon completion, new graduates with a grade point average of 91 or higher are eligible for meritorious advancement to E6, a selective reenlistment bonus, and assignment to an independent duty billet on board an operational submarine. For a U.S. Navy corpsman, there's no other job as demanding, challenging, or rewarding as that of the Submarine Independent Duty Corpsman. True independence. Great responsibility. Unique camaraderie. Take on the toughest challenge of your career and the most rewarding duty you'll ever find anywhere in the Navy. Be the best of the best. Be a Submarine IDC.